The so-called public option government-run insurance program is out, and the Medicare buy-in, which I thought would jeopardize Medicare, cost taxpayers billions of dollars over the long haul, increase our deficit, is out, and there's no other attempts to bring things like that in, then I'm going to be in a position where I can say, I'm getting toward that position where I can say what I've wanted to say all along, that I'm ready to vote for health care reform. My whole point has been here that the president laid out a couple of big goals for this process. Bend the cost curve down for individuals, families, businesses, our government, our economy of health care. And secondly, bring a lot of people in who can't afford health insurance now. The basic core bill does that. I think some of the other things we're going to add to our debt, increase taxes, and were just not necessary to achieve those two goals. So I think we're heading in the right direction.
You've got a lot of insurance companies in your state. How much pressure, if any, have you been getting?
I thought you said you were going to be reverent.
I'm trying.
I haven't received any pressure from the insurance companies. I mean it. Periodically, they'll talk to my staff about one thing or another, but I'm taking these positions. I've never hesitated to take on the insurance companies.
Can you
hold on? And so I'm just, the reason I was against the public option is the same reason that a lot of people are worried about this overall health care reform proposal, which is that they think it's getting too big, and they worry that it's going to increase their taxes and increase the national debt that their kids and grandkids are going to have to pay. So that's why I was
Can you explain why you changed your mind on the Medicare buy-in?
Well, I didn't change my mind on the Medicare buy-in. I mean, I know this is a classic sort of sport here, although it's not terrible to change one's mind if in fact you do. But I don't want to spend too much time on this. In the 2000 campaign, when I was privileged to be Al Gore's running mate, the party platform was to suggest one way to reform health care was to allow 55 to 65-year-olds to buy into Medicare. That's a very stressed age group when you don't have insurance.